Hi, good evening. I'm Dr. Philip McMillan. And for those who have not met me, I've been talking about COVID 19 since early 2020. And my focus has always been through a very straightforward paradigm that COVID 19 or severe disease is a viral mediated autoimmune disease. That's always where I've come from. Every angle that I look at around COVID is from that perspective. And as such, I tend to identify patterns that I think are relevant to autoimmunity. And critically, it helps me to be able to predict what's likely to happen next. And so within that context, I'm making some very important differentiations. Now, anyone who understands how I approach this is that I don't have an ideological perspective. This is just about science. Whatever is beneficial is going to be what you talk about and you focus on. And you look at everything from that autoimmune perspective and how it impacts on health. So, what I'm going to be doing today is I'm going to be sharing with you about this important group life COVID 19 mortality survey report from November 2023. Somebody's going to have to pick up the tab if there are mistakes here. And so this is about the insurance sector. And so I'll be sharing some of their raw data and trying to think carefully about what exactly it means. As I said, when it comes to the discussion about where we are now, I ask a simple question. If the COVID virus was no longer circulating, would we see some increase in mortality? I think yes, because from an autoimmune perspective, if you stimulate the immune system from any source, you can expect that a percentage, even though a small percentage, would end up with autoimmune responses, which can then lead to disease. In the context of areas of the world where you have low vaccination rates, where the pandemic is over, I think for them it's okay. There is no real problem ahead of them. Where we have a problem is in the context of highly vaccinated regions, where you have ongoing circulation of virus and immune priming. And what I've always said, everyone is at risk because the virus is circulating so highly in these regions that everybody seems to be exposed all the time. That is a big population risk around reinfection. Sadly, we still have to talk about elephants in the room. I have to realistically say and infer what I mean because we are not yet able to have straight talk on certain platforms. We just have to not call the elephant what it is. So you have to read between the lines to understand what I'm making reference to. But I just show you the data. And as I said, I focus on the science. At this point, we have the problem that you have immune priming in highly vaccinated regions and ongoing circulation of the virus, which, as far as I'm concerned, is potentially a disaster. So, here is what we have to look at. This is a group life COVID mortality survey report. This link is for the PDF is in the description, so you can look at it at your leisure. And essentially, this here, it's important to note they've put some clear caveats in it, and I'll bring it up in a little bit. They've put some clear caveats in it about who has done the report and why they have done the report. And this here, so I'll show you what it says here. So this is the report here, and the purpose of the survey was to gather a high level view of the USA group term life insurance mortality results during the COVID 19 pandemic. And so you can see here, I've highlighted it. The survey was conducted by the Group Life Experience Committee of the Society of Actuaries Research Institute and has been structured as a recurring monthly data collection and compilation process from the US group term life insurers. So they are looking at the US group life insurers. And the point that I'm making here is simple. If there is a problem, somebody's going to pay for it. And at the moment, the persons or the groups paying for it are likely to be insurance companies. I don't know about anybody else, but it seems as though every single month there are a cohort of highly recognized people who have died. It's becoming so common. I can't quite remember if this was the situation before the pandemic. It feels very abnormal. And as I said, somebody is going to be paying for this. So here we have again, the second part is the committee is grateful that 20 out of the top 21 US group term life insurers focused on employer groups participated in the survey, with market share representing roughly 90% of the employer base group term life industry. So this is pretty representative, they say, of the impact across the USA as a whole. So this is November 2023. So really, really valuable information that they have got here. And truthfully, I was very interested in this all the time because I was saying that if my instincts were right and the science adds up and people are dying, the people who are going to pay for this are the insurance companies. Will they continue to take the tab? Will their shareholders be happy that they are picking up the tab for what could be a number of mistakes in the pandemic? Time will tell. So here is me focusing just on the raw data. As I said, I'm interested in it from a medical point of view. So I'm not an actuary, but I can look at general numbers and get some ideas. And so this is the raw data. And you can see at the top here in purple is the report date. And you can see here, this represents the first number, depending on where you are in the world, is the month. So 6 is June, the first of the month, and the year is 23. And you can then here reported claims. You have the total here. You have the number that are related to COVID. And this seems to represent the premium paid out in billions. So it's 1.8 billion. And they were looking at life exposed. I'm not sure what this means. So I'll not be concentrating too much on that. And so that's the baseline as to what they're looking at. And so within that framework, the first question to ask is, what is the baseline numbers? And so again, you have here, I've just highlighted it here in yellow. And so this was the 2017 to 2019 baseline. And you can see here, it represents 34,000, of which they'd say one COVID death. And the total payout in that period of time was about 1.59 billion or 1.6 billion. And so that's the baseline that they went from with regards to looking at this data. And as I said, anybody can take a look at it because this is important data that that we ought to all look at to try and see if we can understand what's going on. A lot of it will have to be properly vetted from an actuarial point of view, but I'm curious about the raw numbers. What are the raw numbers? And so if you follow along in terms of time, so this is the beginning of the pandemic here. So this is in 2020. And you can see here 39,000. So that's higher than the 34,659. And they only had 4 COVID deaths, 3. But that rises by about April to 40,000. And this would be the first wave of the pandemic, probably hitting the US. And you can see many more COVID cases occurring at that time. And as the year goes through all the way to the end of 2020, you can see at the peak here in December, or in December of 2020, there was 46,526 with 8,000 COVID deaths. Then we go into 2021, and 2021 is where in the US they started to ramp up the vaccine campaign. And you can see that even though that was happening, you also had at the same time Delta occurring. And you can see at the peak here, 50,692 in March of 2021 with 8,200 COVID deaths. And so this is probably around the point of the Delta wave. And it went on right through the summer period. So this is the high 40,000s. And this is well above the baseline of 34 659 for the previous years. But as we come out of 2021 into 2022, that's when we start to see the Omicron surge. So at this point, you're still having high COVID deaths, and you can see the numbers here are still high at about 47,772, 8,700 COVID deaths at this point. And the payout at this point with the 8,000 is about 1.8 billion. So here is where it gets a bit more complicated with regards to the time frame. So I'm moving it down a bit. Now we move into 2022. And you have to remember in 2022, that's when we had the Omicron wave. And the Omicron wave was not as severe in terms of COVID-19 deaths. Well, so we thought. I think some numbers would show differently. But what impact? Because at this point, you had a significant proportion of the population who was vaccinated. And so you should be starting to see either the unvaccinated who had high risk for severe COVID 19 would have gotten sick and potentially died, or they would have got natural immunity. And so you should have had a waning in the numbers for the unvaccinated cohort. And in theory, if the vaccine was going to work the way it should, you should then have a waning of numbers as more of the population was vaccinated. This didn't quite seem to occur. And so when we look again at the figures here, and as we go into 2022 here, you can see that the numbers remained high up to about March. And then as you come into the summer period, it starts to fall a bit and it hits its lowest point here at about 35,000. Then it hits about 34,832. This is the first time it even came close to the baseline of the 34,656. This was in October of 2022, and you still had 956 COVID deaths. And then as you continue now into 2023, we are still peaking 42,000. 42,000. Now the COVID deaths are much lower, so it's about 900. So why are still 42,000 people dying in March? What is going on? The lowest point at the moment is in June of 2023, and we would hope that this is a downward trend with only 267 COVID deaths and a total amount here of 33,951, but this payout is still 1.8 billion, which is higher than the 1.6. So you can see when you look at the payout here, the insurance industry seems to be taking the hit from all of the deaths. Now, as I've said before, quite a number of people will say, well, clearly, it can't be anything to do with the elephant in the room. It has to be the circulating virus. Now, there is some truth in that because I do believe that the circulating virus is a big part of the problem. But the circulating virus can only be circulating because the immune system is not working the way it should, and you can't get to herd immunity. What is the cause of that? Could that be related to the elephant in the room? Difficult to know. So these are the points that we have to reflect on. And my question is going to be to the insurance industry shareholders. You are paying over the odds for this. The insurance industry is going to be hit. And my view is going into 2024, I only expect this to get much worse. Until we can have frank scientific conversations and look objectively at data, we're going to continue to go in circles. We have to be able to honestly address the elephant in the room. More and more information is coming out as to the risks across the population, but sadly, in my view, it's taking too long. The opportunities for mitigation are disappearing very, very quickly. My hope is that I'm wrong when I talk about autoimmunity. But from an autoimmune perspective, once the damage has been done, it can't be reversed. It can be managed, and for anyone who has ever experienced an autoimmune disease or knows a loved one with them, it's lifelong years of treatment with risks of complications. That's not what you would want across your population. And it will certainly have a huge impact on the insurance industry, which in the long run will increase premiums for every single person. These are challenging times. Let us hope that very soon we can truthfully get back to the science. Have a great evening.